Welcome to the Village Talks. This is a space where physiology meets lived experience, where we talk honestly about the body, the nervous system, relationships, and the real questions families are asking without fear-based narratives or a one-size-fits-all answer. We're your hosts. I'm Dr. Jaimy.
And I'm Dr. Brittany. We're chiropractors, perinatal specialists, and humans who work closely with families through preconception, pregnancy, birth, postpartum, and early parenthood. Whether you're preparing for pregnancy, currently pregnant, newly postpartum, raising a little one, or supporting someone who is, you're in the right place.
Let's get into today's conversation.
Welcome to episode 2 of our podcast. I'm Dr. Brittany.
I'm Dr. Jaimy.
And we are here to bring some of the blended real talk when it comes to the perinatal period, and then also really great educational information for that perinatal period as well for you. Today's episode, we are talking about some of the common myths we see in our practice and in our clinic, and what actually helps. But first, we're going to talk about those myths.
We can call this episode Myths versus Facts.
Yeah, right.
I think there are a lot of myths and misconceptions around pregnancy and postpartum. For those of us at Belly Bliss, I think one of the first ones is either a myth or just a misunderstanding about the training and education that is available for perinatal specialists, that not everything does have specialty education, but a lot of disciplines do. And so if you are going to spend your time and your money taking a class or seeing a provider during this time, see somebody who knows what they're doing.
Yeah.
I rarely meet someone who remains with their primary care provider during their pregnancy. So if you have a family doctor, maybe, right? Family docs will deliver babies. But for most people, you leave your GP and you hire an OB or a midwife to manage your care during pregnancy. And so just like you want a specialist to be in charge of overseeing your and your baby's health and wellness during pregnancy, you really do want most aspects of your lives that have a specialty option available to you to be utilized and to see someone that specializes in pregnancy and postpartum. So for Dr. Brittany and I as chiropractors, I think what most of the people in the birth community are aware of is what's called the Webster certification. So this is a great weekend class where you learn the Webster protocol, which is an assessment and an analysis that we use to determine what we are adjusting and what tissues we're releasing in a treatment. So that for me is just the foundation of prenatal chiropractic care. If you are going to see a chiropractor when you're pregnant, please at least make sure that they're Webster certified.
Bare minimum.
That is the lowest bar we can set for treating someone in pregnancy.
And I will say too, sometimes, and I understand this perspective and this outlook on it, and sometimes people don't want to pay the membership to be on the website, to be considered certified, but they took the course. So this is where interviewing is great. Like, hey, are you familiar with Webster? Do you know what it is? Have you learned it? Do you practice it? Where did you learn it? Things like that are really important to ask with providers, because I understand the not wanting to like pay to have your name on a website and all that kind of stuff too. So there are providers who have done it, but no longer are associated with that organization. Yeah. Just want to throw that out there.
Yes. And I think it's also possible to have a provider who's been in practice for 10, 20, or 30 years. And, perhaps because of geography, they haven't been able to get this certification, finances, schedule, any number of reasons. There is so much information to be learned through experience. And so I don't want to discount that entirely. And having the education with no experience, is not ideal. Having a lot of experience with less education can mean it takes them a little bit longer to kind of reach that same level of comfort with a pregnancy practice. And so I do think that anytime you are going to, whether it's a yoga or fitness class, whether it's any type of body worker, right, or healthcare provider, if there exists a training or a specialty in regards to pregnancy or postpartum, be seeking out that person.
Absolutely.
Right.
Like back to Webster, like it is a weekend seminar.
Yep.
It's a great foundation.
Yep.
Yep.
And it is important to understand that it is within the scope for all chiropractors to treat you in pregnancy.
Mm-hmm.
It is within the scope of all massage therapists to massage you in pregnancy, right? There are not, for everyone really outside of, I think, MDs, right, and obstetrics, it's within the scope to continue to treat people, an existing patient who then becomes pregnant. So people have asked me, well, why should I come see you instead of seeing my regular chiropractor? Or why should I come and get a massage here instead of staying at the chain massage location down the street? And I often say, like, if what they're doing is working, right? Like if you feel safe, if you are confident that the way that they communicate with you in regards to your needs during pregnancy, they can speak to it. They seem confident in it. You're receiving care that still feels good to you, that your goals and why you're seeking, that care, that class are being met. Then maybe you don't have to, right? Because there is something to be said for that relationship. They understand your body, or you've been working with this personal trainer. And I'm like, that's all well and good. If nothing changes about your personal training workouts, if nothing changes about your adjustments,
or your acupuncture points,
any of it, right? Like that's not a great sign, because your body is simply not the same in pregnancy. And so, and what works in first trimester is probably not ideal for second trimester and is absolutely not ideal for third trimester. So for them to not make any changes or modifications is probably a good indicator. And I think that's what I often hear when people have come to us from somewhere else is, I've been going to this, XYZ exercise class, and I asked them for modifications, and, they told me I can't do this, this, and this. And so now I'm not really doing anything. Or the opposite, I've asked if there's anything I need to change, and they've said, no, I can do everything the same, but my heart rate's getting really high, or I'm feeling pain or discomfort when I do this. Those are signs that it's probably time to set that aside and move into something more specialized, at least for the remainder of your pregnancy or postpartum as well.
For sure.
So I think that's a really common myth, is that, a chiropractic adjustment is a chiropractic adjustment, a massage is a massage, a yoga class is a yoga class. Absolutely not. There is the difference between modifying what you're already doing for safety and taking a class or seeing a provider whose sole intention is to do something beneficial. Right. Not being unsafe, again, is that lowest bar. We can do better, right? And we know better, so we do better. And we make sure that everything, and I think, most perinatal specialists are going to have that same goal of like, this isn't just safe for you. Like, this is curated, this is intentional, this is beneficial for you at this point in your pregnancy or postpartum journey.
Absolutely. And it's just like any specialty, right? Like, you don't want the chiropractor for the avalanches adjusting you in your pregnancy, and you don't want me adjusting them because I am only 5'4" and I weigh like 120 pounds, right? So it's different, right? Everyone has their specialty. Everyone has what they're really passionate about. And I always recommend, when it comes to specialty, go to someone who's passionate about what they do. I think that's something that when you and I first met and started talking was how passionate you are and what your goals are and how you want to change this entire perinatal period for people in like the best positive way. Not that other people don't, but the passion of it, as you have learned, I'm a very passionate person too. But finding someone who gets it, who understands what's happening, who took the time to take more education to understand the difference between first trimester and second trimester and third trimester, what's happening with relaxin in the system, what's happening in the first 40 days postpartum and beyond, and all the different changes that are happening at every single stage is super important. And the more passionate they are about it, I feel like the more deep dives they take, the more experience they get. They constantly want to learn and do that more consistently is what I've seen. And so I think that's super helpful with finding someone. Just because they can doesn't mean they should.
Yep.
And that's hard.
Yep.
It's a hard one. But I also don't like to shit on people, but I also like to gently say, hey, we can be better.
And I choose to believe it doesn't come from a place of, oh, I just want to take your money, right? They do want to help you.
Absolutely.
Right?
Yeah.
And they are going to the best of their ability with the knowledge that they have.
Mm-hmm.
But when you have someone who is passionate about this work and has done the work to educate themselves, taken the time, taken the classes, then they are now uniquely qualified to best support you through this time.
Absolutely.
Yeah.
Yep.
And I think you said something else that I think is a common myth. So as chiropractors, we're already considered specialists.
Yes.
Right?
Mm-hmm.
So there are subspecialties within specialties. Yeah. And that's across the board, right? Like you can have an orthopedic surgeon who only does knees.
Yeah.
Right?
Or
so
feet.
so there are, we are subspecialists within a specialty of alternative and complementary medicine. And that exists as well in fitness, for example, right? There are prenatal and postpartum specialty certifications so that personal trainers understand the considerations that they need to take when working with these pregnant and postpartum bodies. That is wildly different than perhaps what they learned as their baseline foundation in supporting athletes.
Yeah.
Because again, theoretically, same body parts,
different.
But what they're going through is wildly different. You have to be able to take that into consideration in order to provide the best version of what you're offering to a pregnant client.
Yeah. Yeah.
Some other myths I think we come across are that it's unsafe to do any of these things during first trimester. I think is probably the one that we come across the most often.
Yeah.
It came up in a discussion group recently with someone asking about whether or not it was safe to receive massage in first trimester. And my response, and most of the responses were, it's absolutely safe with someone who is trained and qualified in pregnancy because it's not inherently unsafe, right? So if you've ever taken a medication or a vitamin or a supplement, every single one of them says, if you are pregnant or breastfeeding, please consult with your healthcare provider.
Yep.
It's not because it's inherently unsafe. It's that you need to do this under the care and supervision of someone who understands exactly what is and isn't safe.
Yeah.
Are there some things that are unsafe? Yes.
Yeah.
Is there a chance that's going to happen with somebody who's untrained? Yes. Is that going to happen with someone who specializes in pregnancy? Almost certainly not. I can't speak for everyone out there. So I think, going back to we are specialists within a specialty field, is that if you are being told something is unsafe, it might be, or it might just be unsafe with the person that you spoke to.
Yeah.
Or oftentimes what I will say, they're like, well, they said I can't do it because, or they told me not to do this. And I'd say what that response tells me is that they're not well educated on this topic.
Yes.
Right. And they can't accurately speak to the safety of massage, for example. And so they're erring on the side of caution, which great. That is my preference. If you don't know what you're doing, then just don't do it. That keeps everybody safe. But I think then that person is left with the perception that, well, this just isn't safe at all.
Yeah.
And that's not true.
Yep.
We see it a lot in third trimester as well, right?
Yeah.
Like we can't do this in third trimester because, or I can't get an adjustment while I'm in labor, or I can't. And I'm like, well, did your water break 72 hours ago and your contractions are 3 minutes apart? Like if you're not trying to have a baby in our office, then maybe no.
Also, it's not the most comfortable.
No. But have you had a couple contractions today and there's no other signs of labor? And, you feel comfortable driving and you live close by, or you have a partner that can drive you in case things change quickly, then it is safe for you to receive this service, but it's also not that simple, right? We got to kind of look at other factors.
Yeah. Well, and the understanding too, I had a client recently where she was like, oh yeah, I had a bloody show this morning. And I was like, did you? Because you wouldn't be here. Was it your mucus plug?
Yeah.
Or was it your bloody show?
Yeah.
Right? Because that's also a very different understanding of what's happening. And yes, it was her mucus plug. So great. Yeah. Like, let's get you adjusted. Let's get your body ready. Let's have you kind of do your thing and then just go get some water, take a nap. Yeah. Let your body do what it needs to do. Yeah. But even those types of myths and things like that. Well, like, we had a client yesterday who was in early labor and she was like, I debated coming. I didn't know if I should. And I was like, yeah, let's do it. Like, let's absolutely get you adjusted. It might look a little different. We can adjust in between contractions and things like that. But yeah, totally safe.
Yeah. Yep. It is safe. So, I think there are a lot of myths around. I think there's a lot of generalizations, right? That something is inherently unsafe in pregnancy. On the flip side of that, I think that, sometimes things get pushed too far in the other direction, right? So running in third trimester, is it inherently unsafe for you and the baby? No. Is it, is it doing good things in your body in terms of preparing you for labor and birth, right? And in that case, I would also say no. I'd like to ask patients, well, why do we want to do this? Like, what is our goal here? What's, and if it's, this is really the only way I have found to relieve stress, this is for my mental health, I get it. And so, then there's kind of a risk benefit analysis here of like, you're coming to me telling me that you're having this specific pain issue. And it's become really clear to us that this pain is at least aggravated by, if not caused by, your running. Yeah. So we really have to take a look at, is there an alternative? Can we come up with an alternative? Yeah. And if not, okay, then what actions can we take to try to offset the toll that it's taking on your body? Yeah. Right.
Well, let's talk about why. Let's talk about the pressure that running does put on your pelvic floor and your core and everything that's involved. Because a lot of times people think, well, I don't have any issues. Yeah. So I'm fine. Yeah. And just because we don't have issues doesn't mean that the body's not compensating in a way, because we do have to adapt and modify in pregnancy. Yes. And we're doing that constantly, which is our biggest thing that we teach our clients is we're not weak and fragile. We're making these changes because your body's inherently different than it was when you were doing it beforehand. Yeah. So let's talk about why something like running can have an impact on your pelvic floor and your birth and your postpartum recovery.
Well, and it comes back to goals, right? And I think when we can talk about this in reference to running specifically, but it really is going to apply to any high intensity or high impact exercise. Yes. I'm not in the camp that is, you should never do those things or that they're dangerous, but we really do have to take you as an individual into consideration, right? Yeah. What are the goals with this exercise? What are your goals for birth? Yeah. Strength is incredibly important, but so is the ability to soften, the ability to lengthen, and the ability to yield. And because your intra-abdominal pressure is increasing, right? We are supporting the weight of this baby within that closed pressure space.
Which is what?
The intra-abdominal cavity, right? So we have between our respiratory diaphragm and our pelvic diaphragm or our pelvic floor is a closed pressure system. Yeah. And so every day cells are multiplying, baby is growing, and your body is trying to find a way to maintain this neutral pressure despite this internal growing force that is going to just continue to increase pressure unless your body finds a way to accommodate for that. Yep. So this is that the diaphragm lifts and remains somewhat elevated, that the pelvic floor may drop and remain somewhat lower, that the abdominal wall is going to stretch and expand, right? The lower rib cage is going to expand. This is the way that our body is built to adapt for this. Yeah. We need to allow that process to happen. And so when we have a high level of tone or strength in any of these muscles, because your diaphragm is a muscle, your pelvic floor is a muscle, your abdominal wall is muscle, your uterus is muscles. If we have a high level of tone or strength, then there may also be a higher level of resistance to that lengthening or softening or yielding.
Yeah.
And so it really is trying to find that balance. And I think in the days of social media, especially, there's a lot of focus on being a fit mom.
Yeah.
And I think that you can absolutely be fit and still have a great birth, but you really do have to understand the dynamics of it, right? Yeah. And if the way that you exercise and remain fit has not changed in any way, statistically, we do see these patients having longer labors, and potentially more complications. So our goal is to shorten your labor and to not have complications. And so we do often have these conversations with patients about how really just shifting the mindset around exercise. And third trimester is not a time to be increasing strength, right? We're not hitting PRs. It's not because you can't, right? This isn't about what you're not capable of, right? Like, you probably can lift the same amount of weight or run the same distance at the same speed. You have worked hard to have a very strong and healthy body. It's not about your capability. It's whether or not this is moving the needle towards this goal of having an uncomplicated birth so that you can have a more complete postpartum recovery, so you can get back to this level of exercise and intensity that you love more quickly without complications.
And safer too, right? Like, that's one of the kind of bleeds into one of the other myths we see a lot of is we've normalized suffering in pregnancy. And when I say suffering, it doesn't mean like you're having a terrible pregnancy and you hate being pregnant. It's, well, yeah, I like pee a little bit when I run or when I cough or when I sneeze, or, I have like reflux all the time and it's usually positional, or, I have really bad low back pain, or I'm getting pubic bone pain, or I'm getting sciatic, right? All of those things we've normalized of like, well, that's just because you're pregnant.
Yeah.
And I'm like,
there's nothing you can do about it until baby gets here. Yeah. Or my favorite is, well, I just get normal headaches. Headaches aren't normal. They're common. Yes.
I just have a bunch of hemorrhoids. Like, they're uncomfortable, but they're here. Yeah.
So there is this certainly a perception that pain is normal in pregnancy. And I'm like, discomfort, yes. Like, you can expect to be uncomfortable at some point in your pregnancy. It is a lot of change in a very short amount of time. And so it does often come with some discomfort. But pain is not normal until you're in labor. And if you're experiencing pain, seek help. And if the person you've sought help from, tells you there's nothing they can do about it, that's okay. You've asked for help from the wrong person. Because just because they can't help you doesn't mean there's no help to be had.
Exactly.
And so we do hear this a lot. I think, especially with musculoskeletal pain, you know, it gets dismissed by someone and like, well, they said there wasn't anything they could do. And I'm like, well, there's nothing they could do, but let me share with you how I can help you, right? Or this care can help you, or even better, we can help you help yourself, right? Like, I'll never forget, I don't know how many years ago it was, but I had a patient come in and she was coming in for abdominal pain, and she had seen her OB and ruled out all the big and scaries, right? We don't have any issues with gallbladder. We don't have anything. They thought that it was probably muscular, and recommended, I don't recall if they specifically recommended chiropractic care or just were like, somebody else can help you with this. So she came in, we go through all the exam and everything. And I'm like, I cannot reproduce this pain, right? Nothing I touch, no stretches, no exercises, no orthopedic tests, nothing is triggering this pain. And then as we go to have her sit up after doing a supine or face up exam, she goes and sits straight up. So I always walk them through, like, bend your knees, let's roll to your side. She didn't listen. She sat straight up. I'm watching her. We have a pretty obvious diastasis, and she's like, there, right there, that's the pain. And I was like, oh my gosh, like, how many people have you talked to about this? And this is really, that you do have some abdominal separation happening. It is very common. And so while this pain doesn't indicate that you need to go on bed rest or your baby needs to come earlier, that there's anything big and scary going on, let me show you how to get out of bed. And guess what? We never had the pain again, right? Like, so she's all excited. And I was like, you overpaid for that information. But it's even just let me help you help yourself.
Absolutely.
Like, let's dial in and dig in and figure out exactly why this is going on.
Yeah.
And it wasn't anything I did. There was no treatment that I rendered or magical adjustment. You know, it was just some patient education.
Looking from a different lens too, right?
Just giving her the tools to go home, giving her a new way to get out of bed.
Yep.
So that we didn't fear that pain.
Yeah.
So I don't remember why we went down that rabbit hole. I think we were talking about exercise.
Yeah, we were talking about abdominal pressure, right?
Yeah.
And like all of the things that I listed have to do with some type of imbalance in that abdominal cavity pressure that is a closed pressure system. So just kind of bringing it all together of things that we see.
And I mean, our knowledge of, you know, the pelvic floor and this system in women in particular has grown exponentially in the last 5 to 10 years. Yep. You know, as with most things, but absolutely with most things medical, most of our information is based on studying male bodies, male cadavers, male research subjects. And, you know, a woman's pelvis and sacrum and pelvic floor, this whole system is entirely different than it is in a male body.
Yeah.
So as we understand more, we want to use that information to do more and do better. And so it's not that all of those exercises are bad. It's that they're often not taking this new information into consideration. And it can often be through a very narrow lens of, well, you're here to get a workout or you're here to exercise. And so this is what we're going to do. But it has to be through the broader lens of how does this impact the pregnancy? How does this impact these tissues? And how does that affect your birth? Yep. Right.
And postpartum recovery.
Yes.
Yeah.
And is that impact part of your goal? In which case, great. This is getting us towards that goal.
Yeah.
Or is it actually completely contradictory to what we are trying to achieve?
Absolutely.
I never like to tell anybody, stop doing this, don't do it.
Yeah.
If I do, it's usually like, okay, let's stop for a week or for 2 weeks. Like, let's just have a little bit of time here. Can we reduce the irritation, inflammation enough so that you can reintroduce this? Can we run an experiment and see, you know, and unfortunately for a lot of people, it does take that reprieve and that time to be like, that really was what it is. I'm like, I'm sorry. I'm sorry that is what it was too.
Yeah.
What else can we do? Right.
Yeah.
What else can we introduce? What other options do we have? Because a lot of times people don't know what other options they have. Yeah. Right. Like if you grow up a runner, running is what you do. Yeah. I was a runner. Right. And in having conversations with midwives, they're like, oh, we can tell on the first internal exam whether or not you're a runner because of the tension in the pelvic floor. And I'm like, well, it makes sense.
Yeah.
How many thousands of steps and miles with your pelvic floor keeping your organs inside your body? Like, yay, you did your job well.
Yeah.
But if you're not doing anything to offset the tension and release the tension.
And you're sitting all day for your job, your hip flexors are tight, and you're running.
Yep.
Everything
it just builds over time. And now, you know, relaxin works well to increase the flexibility of your joints and your connective tissues. It doesn't do that for muscle tissue. Yeah. Right. Like we've got
I feel like that's a common misconception too about relaxin.
Yeah. Yeah. And you know, we don't recommend static stretching frequently because great, you're stretching your joints and your ligaments and your tendons. But you know, that muscle belly that feels tight, we haven't done anything there.
Yeah.
So yeah, again, it's just education around, you know, we are in a super stretch happy society. Everybody, we're all kind of trained to feel a stretch.
Yeah.
Stretching isn't always good, especially in pregnancy. So we want to find more productive ways to release tension. Yeah. I think.
Well, and if a muscle is already lengthened too, and it's already in that lengthened state, like it might feel good in the stretch, but it's going to go right back.
Yes. Yeah. We're not making change. So oftentimes I'm like, the stretching may not be bad, but it's not really doing anything. Yeah. So like if you want to do it, that's fine. Sometimes I'm like, actually that stretch is making things worse. Let's stop that one. Yeah. But oftentimes it's like, if it feels good and you want to do it, go ahead. But I also need you doing this, which is what's going to make the change. Yeah. And that you may not feel a stretch here. Yeah. There's no satisfaction from this because you don't feel anything out of it. But I promise it is what's going to make the change. Yeah. That sometimes, again, seeing a specialist is going to be able to kind of tease those things out.
Yeah.
There's a lot of great information out there that is tailored to pregnancy, but it's not tailored to your pregnancy.
Yeah.
So I think this is another thing is like, well, I'm at a prenatal yoga class, right? So obviously this pose is safe, but it hurts every time I do it. Let's stop doing that one pose, right? It's not unsafe. It's not dangerous for you and your baby. It's not ideal for what's going on in your body right now, right? Whether that's a posture, whether that's a pattern, or you have this irritation from slipping on the ice last week. And so now until we can get this settled down, we're not going to do that. Your body doesn't like that, right?
Yeah.
I think a lot of people are very disconnected from their bodies.
Yeah.
I think that's another myth of like, oh, I'll know I'm in labor, or
I'll know when to push.
Yeah.
Things like that.
Or I know how to push.
Yeah.
So it's like, yes, trust that your body is built for this.
Yep.
But also listen to your instincts. When your instinct tells you something doesn't feel right, go with that, or this doesn't feel right. I think
explore it.
Yeah. I think sometimes people are like, well, this sometimes it's us. I'm like, I give you 3 exercises, do them all for the next time I see you so you can tell me how they feel.
Yeah.
And they're like, it really hurt. I'm like, I specifically said if it hurt, don't do it. Or maybe I didn't mention it that day, or I assumed that they had that knowledge and they didn't. And I'm like, okay, let's stop doing that exercise.
Yeah.
Let me put a different one in here.
That's
or
why
we
it's
just
called practice.
Yeah.
We got to figure out what works specifically for your body, right?
Yeah.
There's all these things online and Instagram of like, do these 3 exercises and you'll never have to push your baby out. It'll just happen, right? It's like, well, that maybe worked for them.
Yeah.
Will it work for you? Maybe not, right? Like every single body is individual and the care has to be individualized too. And so those exercises might have helped another patient client of yours and maybe not this one, right? So that's why it is trial and error, but we're also not going to do let's wait and see. Let's wait and see if it gets worse, right? Let's see what we can do about it and how we can help your body adapt better.
Absolutely.
Yeah.
Yeah. And I think touching back on sort of the instinctual piece of it, right? And listening to that inner voice, there are so many who, because they haven't been pregnant before, they don't feel that they have instincts.
Yeah.
And I think you do have them. I think we are disconnected from our bodies. I think there's something to be said for taking the advice of professionals, even us, right? But, whether it is somebody who is on social media speaking from a place of expertise or somebody speaking out of turn on something they know nothing about. You try something and you're like, well, yeah, it's supposed to be good for me. It's supposed to be safe for me. This person told me to do this, but it doesn't feel good, or it causes pain, or I feel worse afterwards. Like, keep asking questions. It doesn't mean that person is wrong about things.
Totally.
But yeah, we're all making our best guesses, and a lot of times we are going to have to run an experiment here. We're going to have to see how your body does with this. If it is something that you're getting online or not from an individual resource where you can ask questions, then go to your in-person resources and ask. Lots of people now are on apps or, doing exercise videos on YouTube. And there didn't used to be a lot of programs. So I used to be familiar with them. Now I'm like, I haven't heard of 95% of them.
Yeah.
Doesn't mean they're not good.
Yeah.
But I'm like, how do you feel when you do those things? Right. And if they're like, yeah, they all feel good. I'm like, great. I'm like, if you ever come across a move or an exercise or something that doesn't feel good, let me know so we can review it.
Absolutely.
Do we modify it? Do we eliminate it? Do we replace it?
Are we doing it correctly?
Yes.
Right.
Oh. Yeah. It's hard.
It's so hard.
Right? Even
there's
with
so many variables.
There's so many variables. And even with, like, I had a patient yesterday who is postpartum and has been working with a personal trainer, and she has some nuances to her posture. So she is hyperkyphotic. And so,
which means what?
So she has an increase in her curve in her thoracic spine.
Yeah.
So it means that her origin and insertion points for some of her shoulder muscles are slightly altered.
Mm-hmm.
It changes her body's ability to do certain overhead exercises correctly without compensation.
Yeah.
And so the long and short of it was the adjustment is not the answer. You're going to have to do some release work on your body in order to get your shoulders into the correct position. And, the trainer's answer was to just push her arms there. And I'm like, all right, on one hand, like you're now in the correct position, but your body hasn't learned anything new.
Yeah.
Right. You have to be able to get into that position in the first place because the reason you're not getting stronger and you're having pain in this other muscle group is because this muscle is doing the exercise. Your traps are doing the exercise.
Yeah.
This is not trap exercise.
Yeah.
And by forcing your arm into the position, your traps are still the only muscles that are activated.
Yeah.
So it looks like you're doing it correctly, but we're not gaining strength in the muscle group that we are trying to strengthen. And in fact, we are just increasing tension in the compensatory muscle group.
Yeah.
So it's, again, down the rabbit hole, off on the tangent, forgot even why I started telling this story. Yeah. But it's
nuance. It's very like there's so many different variables that you have to take into consideration when it comes to like what will actually work for your body versus somebody else's.
Yes. That's where that cycle circle started there.
You reel me in, I reel you in.
Yeah. But I mean, that's the thing. She's like, I'm exercising. So she's out there exercising. Mm-hmm. She has hired a personal trainer, right? This is one-on-one. So she feels like she's doing something that's good for her body. And for the most part, but now I also have this pain that I haven't had before. Mm-hmm. And so like, thankfully she is an established patient in the office and she's able to come in and be like, maybe I just need to get adjusted. Right. Yeah. Or, maybe you'll tell me it's muscle and need to get a massage. Mm-hmm. But my takeaway was like, yes, there is tension. I'm happy to adjust you because we have this compensation pattern, but also like, here's what you can do. And you don't have to stop going to personal training.
Yep.
And there is this one exercise that I was like, I think for now, this probably isn't beneficial until we can kind of shift things a little bit. So, having that understanding of, because it wasn't hurting while she was doing it.
It was after.
Right? Like that. Yeah. So sometimes that's the piece too. It's like, well, nothing hurts while I do it. I don't have pain while I do it. But since she started seeing this personal trainer, we now have more pain and tension in the trap muscles. Yeah. And so, she sort of ties them together, but can't. And so I'm like, literally walk me through every exercise that you're doing.
Yeah.
And you don't want me training you. You don't want me as your personal trainer. But I know enough about those to understand how they are impacting what I'm finding in your body.
Totally.
And so that's what I say, like, even if I can give you the exercise, ask us about it, right? Because we do understand the pain you're experiencing, the inflammation we find, the irritation we find, the misalignment we find, the muscle tension we find. And so if your goal is to get rid of that pain, then we'll do what we can here in the office. But what happens when you leave makes a difference. So don't ignore the pain. Don't discount anything. The number of times something new pops up, like, well, what do you think it was?
Yeah.
It's not always a slip on the ice.
Yep.
It's not always overdoing a workout or sleeping weird. Mm-hmm. Sometimes it's a lot simpler than that, or it's not something that happened it's not one major trauma, right? Mm-hmm. It's 1,000 micro traumas, right? It's micro trauma 1,000 days in a row or something like that. So, have some awareness of what's going on in your body.
Yeah. Listen to your body.
Tap
into your intuition.
Yeah. Whether your body is like, yes, do this or don't do this. Like you got to listen both ways.
Yeah.
Nobody knows your body better than you do.
Totally.
It's the same thing with babies, right? Yeah. Like nobody knows your baby better than you do. Mm-hmm. So absolutely ask for opinions and ask for advice, but you have to take that advice through the lens of, your body best, your baby best.
Yeah.
And not ignore the little voice or the instincts.
Yeah.
Yeah.
Oh, so good. We could go on and on and on and on. I think this should be like part 1, part 2, part 5 million of things that we see in the clinic that are common myths and things like that. Because there's just this is such a broad spectrum of things that in perinatal period, from fertility all the way through parenting, that there's so many things that we can touch on. So I think this will probably be a good stopping point for it. And we can,
this concludes our first myth versus fact, exactly. But I doubt it will be our last.
It will definitely not be our last. Thanks, guys.
Thank you.
If you found today's episode helpful, you can subscribe, share it with a friend, or leave a review. It helps this podcast reach the families who need it most. You can find us at Belly Bliss in Denver and online for resources, workshops, and support. Until next time, take care of your body and trust its wisdom.